Okay, good afternoon, everyone, and thank you for joining me here today to allow me to provide you with an overview of some of the steps that have been taken to date by the Ministry of Health to ensure the safety and security of our children in care settings. As the ministry responsible for administering the licensing and registration process for daycare centers and daycare providers in home settings, we are acutely aware of the need for quality care and the history of concerns. These concerns have been highlighted recently by a report of an infant allegedly suffering a head injury during his time in a daycare center. All affected families have been notified, and we can advise that the center in question is Heavenly Blessings Nursery and Preschool. Regarding this particular case, the Children's Act of 1998 does authorize the Minister for Social Development and Sport to inform the public of an order in such a manner as he considers appropriate. This was done through Tuesday's press conference. However, this same piece of legislation does prohibit disclosure of information where there is an active police investigation. Consequently, there will be no details discussed at this time. Nevertheless, I can give assurances that an investigation is taking place, and I want to assure the public that we, this government, take our responsibility for the care of Bermuda's children very seriously. As such, I want to provide you with an update on the steps that we have taken to increase the quality and safety around the care of Bermuda's children. These include the following. 1. We developed and published the Childcare Standards for daycare providers and centers last year, November, and we updated these standards in June of 2018. In September of this year, the Cabinet recently approved amendments to the Children's Act of 1998, which will include the creation of a new Child Care Act, establishment of daycare regulations, as well as to regulate other child care settings. In August of this year, we established a designated resource to review and upgrade all environmental health policies and procedures around daycare. In addition, we are developing a non-compliance exception handling policies, which will look to create an interagency team to review daycare concerns and facilitate interventions, learning, and improvements as needed. Parents need to be able to go to work and know and trust that the persons that are watching their children and caring for them will ensure their safety and promote their optimal, healthy development. Our vision, as captured in the Childcare Standards, is a community where parents, care providers, and the various government agencies vigorously collaborate to assure that Bermuda's children are given the best start at life. We all need to be on the same page and uphold the new standards during these critical early years of our children's development. The Ministry of Health has identified the concerns of this sector and has been taking active steps to address them. I want to close by expressing my sincere thoughts and sorrow to the family of this child. Our prayers and thoughts remain with them. Thank you.
Thank you, Minister. Your colleague, Minister, in his press conference on Tuesday, I think it was, declined to name the facility. Why are we naming them now?
As I indicated in the statement, the family members that were immediately impacted by that have been notified, and as such, we've decided to name the facility.
Okay. Right. Isn't there a presumption of, some people might say the government is acting too soon by shutting it down while the facts have not yet been determined. What do you say to that?
Well, the minister responsible for social development and sport does have within his remit under the Children's Act 1998 provisions in certain circumstances to close a facility. He exercised that power pursuant to the legislation and pursuant to his powers as the minister responsible.
Right. Because he has the power to do it doesn't mean he should do it.
Well, the minister in his infinite wisdom would have made a decision based on the information that would have been provided to him to act in accordance with his legislative remit.
Right, okay. Why are we not having a joint press conference with that minister? Because it involves both of your ministers.
It does. Actually, historically, when the Children's Act of 1998 was first enacted, at the time we had the Minister of Health and Social Services.
Right.
Obviously, subsequent to that, the ministries have been split. So we have the Ministry of Health, who is responsible for licensing and registration of daycare facilities, which is what I'm speaking about here today, so that I can inform the public of the processes that we've taken since last year. And in fact, almost a year ago to this day, I stood before you and provided information concerning the Childcare Standards. As I've indicated, we are moving forward with those standards to have them regulated so that our daycare providers can have further regulations. And there'll be amendments so that we'll have a standalone Child Care Act.
Okay. Are there regulations and guidance for residential treatment facilities for children here? Because this is not included in this document, is it?
I can't answer that. I could perhaps have my director assist me, but this is dealing specifically with children, care facilities, daycare facilities.
Daycare, not residential.
No, this is care facilities.
All right. Can somebody
either in a person's home or alternatively in a building, an institution.
Right. Okay, so we've had, this morning I spoke to Tiffany Thomas, who, as you probably know, is a litigation guardian. And she's decided to stop providing her services because the government hasn't paid her for the last 4 years. The services she's offered for the first time since the Children's Act was implemented in '98. It just sounds a bit contradictory. I mean, we've had ministers like you and your colleague say we care about our children, but here's somebody who's performing a vital service for children and not getting paid for it. And there's ongoing cases that will put these children at legal risk. What is your reaction to that?
Well, you've told me more information than I know, so obviously you have.
I'm glad I'm informed.
Yeah, you are informing me about that. But the issue.
This is not a new issue. It's been going on for a while.
The new issue about
litigation guardians.
Right, but the issue concerning litigation guardians, like I said previously, the 1998 Children's Act was enacted at a time when health and social services were one ministry. Subsequent to the enactment, there are now two ministries. There's the ministry responsible for social services, and then there's the ministry responsible for health, which falls within my remit. Issues as it relates to litigation guardian fall within the remit of Minister of Social Rehab.
Right. The reason why I'm asking you these questions is because you're a minister and you share collective responsibility.
That's absolutely correct.
And the minister who you referred to is not here, and he hasn't held a press conference since he hasn't held a press conference on the issue of child abuse allegations in his own department in 4 months. We have this allegation, this issue with the daycare surgery center, and you've had 2 press conferences in 1 week. I don't understand what the government is. I honestly don't understand what the government's position is about the care of our children.
Well, the government's
the most vulnerable children.
Certainly. The government's position is, with respect to the care of our children, is actually commences from the model of the UNICEF, which indicates that children between the ages of 0 and 3, it's critical period as it relates to their emotional, social, and physical development. And the government is committed to ensuring that we take steps to meet that mandate by UNICEF. And one of those steps, as I've previously indicated, is the development of a code of, excuse me, I've got it right here, the Childcare Standards, which were developed over a year ago and were introduced. It was a process that took place with the government, with stakeholders, child care providers, the Department of Health, the Child and Family Services, as well as the Child Development Project. So all of those departments and stakeholders met together to come up with this Child Care Standards. And it covers a number of things as it relates to the education of our children, the well-being, the physical environment, and the like. I'd invite everybody actually to take this opportunity to read this. It has been on our website, and it was, like I said, made public last year, November. These standards are very, very critical. The next step will be to take these standards and turn them into regulations, as well as I said previously, to have a Childcare Act, a standalone act to address these types of matters.
But you can't tell me about whether there's actual guidance for residential treatment facilities.
Residential treatment facilities, notwithstanding that we do have collective responsibility, those questions should be best asked of the ministry that's responsible for residential treatment centers, which is not health.
So health doesn't have any jurisdiction whatsoever over those facilities?
No.
Wow.
Minister, we've had 2 incidents, one earlier this year with a facility, the church facility, that incident which was neighbors spotted 2 children wandering off, and now this. Is there time for revamping of the whole system when it comes around to the care and control of these children? Security cameras were called for more an investigation, a deeper investigation, or an inquiry into the whole standard of this system?
I think one of the starting points is something that, as I indicated previously, that Cabinet just actually approved in September, was for us to establish legislation that provides for just child care. So we'll have a standalone piece of legislation that will speak to the child care facilities, regulations that are effectively mirror the Childcare Standards that I spoke about previously, and all of those matters collectively, as well as I've said, we've got a dedicated resource that's going to help to draw the other departments in the ministry, of the other ministries together, so that we can address this in unison. But I actually do believe that government is certainly committed to ensuring the safety and the protection of our children, our vulnerable citizens, and as such, we are doing just what is necessary to ensure that parents can go to work during the day and recognize that their children are going to be cared for in a safe and loving and healthy environment that will stimulate them as well.
Thank you, Minister. You said that you offered obviously thoughts and prayers for the young infant who is hopefully recovering in hospital. Can you give any update on the condition of that infant at all? I think the Minister said the other day there that the baby was improving. Is that still the case?
I'm afraid I don't have any further update than what was reported on Tuesday by Minister Weeks.
Certainly. And Minister Weeks also said that there had been perhaps a few other incidents at the childcare facility in question. Can you tell us whether or not they were investigated by your department? If so, what was the outcome of any investigations? If the nursery itself was found to be at fault, why was it still operating up until this week?
Okay. As I said previously, I thank you for your question. However, there is still an active police investigation, and it would totally be it would not be proper for me to comment any further as it relates to that, because it could further prejudice or compromise the investigation. So it's totally inappropriate for me to comment at this time.
Even to say whether or not investigations were carried out by your department with regards to
because of the active investigation that is ongoing, it is inappropriate for me to comment any further on any of the circumstances surrounding that investigation.
Okay. And you said also it's important for parents in Bermuda to be able to go to work and know that their children are being looked after in a safe and secure environment. With that in mind, is your department going to reconsider its position with regards to making available records with regards to daycare and nursery facilities at which complaints have been made, serious concerns have been raised? There were some redacted files released a few weeks ago, maybe a couple of months ago. Will your department now make those records available with the names of the facilities included for public viewing?
Okay, and I'm not sure who you are, but are you referring to the PADI requests?
Correct.
Yes, okay, I thought so, but thank you.
Sorry, yes.
No, that's fine. Thank you for that question. Any matters that relate to PADI have to be directed to the information officer directly. Obviously, I'm not the information officer, so any questions or circumstances surrounding a PADI request or the information that was received pursuant to a PADI request have to be made directly to the information officer, to whom I'm not.
Couldn't these just be automatically published on a website, though, as they are in other jurisdictions?
Again, I'm not familiar with the entire circumstances of those PADI requests. Many of them did predate me, but again, that's information that would have to be requested directly from the information officer for the Ministry of Health.
I understand what you're saying, but I mean, irrespective of PATI altogether, simply records, inspection reports from facilities where Bermuda's parents are sending their children, can those not just be made automatically available for people to view?
If you look under the legislation, the PATI legislation does define a lot of the parameters and what types of information is actually excluded information. Information that's obviously relating specifically to government entities is provided unless it's excluded. When you're talking about entities that are not government entities, the provision with respect to the disclosure of that information, as is outlined in PATI, does have certain parameters around it. In other words, third-party consent is required. So if you look at the PATI legislation, it will indicate clearly the types of records that can be obtained and the circumstances in which exemptions can be made. But there certainly is the issue under the regulations of PATI that deals specifically with third-party disclosure. But I'd also want to just, as I indicated, there is the regulations of 1998, the Childcare regulations, 1999. And what it does provide is that any operator that is operating a care facility must, by law, they are required to ensure that a record is kept of all of their inspections and any recommendations that have come from those inspections. So I would invite anybody that is interested in knowing or pursuing any type of child care facility services for their own child to utilize the regulations and make that request to the facility and ask them, where are your inspection records and what were the recommendations? Because they are required by law to keep that. If, on the other hand, that care provider says, I have no records or I do not wish to disclose them, then you might want to try somewhere else.
Sure. And in light of the recent incident then, is there any plan or intention, to do a thorough review of every nursery or daycare facility on the island as soon as reasonably practical?
Well, the staff at Environmental Health, and then in conjunction with some of the other departments under social rehab, do carry out regular inspections with respect to these facilities. Obviously, they continue to execute their function as diligently as possible. We do have a new director of the Environmental Health Department who obviously has this within his remit. So I can assure the public that, again, this government is thoroughly committed to ensuring that our most vulnerable citizens, our children, are protected and are residing in facilities that we feel are safe and that provide them with the care that's required. Thank you.